Before we go into the live surgery, the stage is going to be set by Dr. Pranav Ranjan, and he's going to take us through trifocal IOLs.
Dr. Pranav Ranjan to speak on, Dr. Pranav Ranjan, please. To speak on when to do trifocal IOL indications.
Good morning, everyone, and respected dignitaries of ophthalmology of India. It's a huge privilege for me to be invited by Trenetralaya, which symbolizes the eyes of the Lord Shiva. So with these words and words of gratitude to Team Trenetralaya and particularly Dr. Partha Biswas, so I'll be talking on the indications of trifocals, the advantages and the disadvantages. So what is new in IOLs? In the last 2 decades, we have seen a lot of paradigm change, new things coming up like asphericity, square edge designs, toricity, presbyopic correction, of which the ideal would be an accommodative lens, but a compromise of date is the multifocal, the trifocal, and the ADOF. So why a trifocal? There is a paradigm shift in the visual needs of everybody. We need to read the mobile phones, we need to read the computer screen, we need tablets, we need driving at daytime, nighttime, we need to look at the cluster of the speedometers and other things which are there. So we need a distance vision, an intermediate vision, as well as the near vision at one go. And if you want to be spectacle free, trifocals is the answer. And why a trifocal? Because if you compare the image of the monofocal with the trifocal, especially for near vision, you'll not be able to read anything with the near vision. You'll have a good vision, great vision with monofocals. But with trifocals, you can read the computer screen, you can read the fine prints as well. A comparison between the ADOF and the trifocals, the ADOF gives you an intermediate and a reasonable near vision and a good distance vision, but trifocals for specific reading and small letters, trifocal is the answer. So here you see with the example of trifocal, the map which you can see in navigation and all, the small prints with the trifocal, which is not possible with the ADOF lenses. So what are the basic requirements? You need to have a good distance vision, intermediate vision, which is needed for computers and all, average being 80 centimeters, and a near reading vision, books and all, to have a reading vision at 40 centimeters. So a comparison head to head, a monofocal has a single focal point, gives you a good distance vision, poor intermediate and near vision. You have to be completely dependent on glasses, but the advantage is no night vision symptoms. The multifocals or the trifocals have more than 2 focal points, has good distance, intermediate and near vision, has the highest spectacle independence, but there are night vision symptoms which are present with that. The ADOF lenses gives you a continuous range of vision. Unaided near vision is usually subnormal in comparison to the multifocals. Spectacles are needed especially for fine prints, and night vision symptoms are negligible, less in comparison to the multifocals. The disadvantages of the multifocals and the trifocals is the halos that you see in the pictures. There is a loss of contrast, especially during night time. There is a comparative picture. The upper one shows the daytime bright images between the trifocal. The lower one shows the nighttime images. This is just a simulated image comparison during daytime, slightly overcast conditions, and during nighttime. So choosing the right IOL, what do you need from the patient? You need to assess the lifestyle, the activity, whether he is an active patient or a sedentary patient, the occupation of the patient, whether he wants to do a lot of screen work or fine print or both of them, what are the driving requirements, whether he is will be able to tolerate glare, halos, and night vision when you have explained to him how that will be disturbing his vision, and how much motivation he has to get rid of glasses completely. There are few contraindications for the multifocal and trifocal, like the corneal scar, the irregular astigmatism, post-RK, poor ocular surfaces, and severe dry eye diseases. They have high risk of poor vision as well as post-operative glare and halos. Glaucoma, diabetic retinopathy, and macular degeneration, they reduce contrast sensitivity, so they have to be used with caution. Contraindication, occupation and personality wise, people who do a lot of night time driving, personality traits like anxious patients, dominant personality, obsessed patients, not satisfied, complaining patients in the OPD. They are the people who should be generally avoided. You have to also consider the angle alpha and the kappa when you are examining the patient for the multifocal IOL, and all the optical center, the pupillary center, and the visual axis should be as close to each other if you want to have a good visual outcome. So what you see on the picture on the right side, when the visual axis, the optical axis, and the pupillary center are far apart, more than 0.2 millimeters, they are not the good patients for multifocal diffractive IOLs. A good candidate will be one who has got an active lifestyle, complete independence from glasses, willing to accept visual disturbances, not involved in active nighttime driving, not a demanding patient, and the angle alpha and angle kappa is less than 0.5 millimeters. This is just a short video clip from a surgeon of ophthalmologist from Mexico who undergone a trifocal implant, and this is what he said. After the implant, he was able to do all surgeries, he was able to drive, he was able to do mountaineering, see beach, he was enjoying his life like anything. So after having lot of experience, having implanted the trifocal lenses, he himself got trifocal lenses implanted in his own eyes. So the take-home message is that the patient should be well informed and counseled, convinced that his vision will not be like a 20-year-old child, that this is the best available technology as of date. Bilateral implants should give him a better vision, and neuroadaptation may take up to 6 months in few subjects. Thank you so much for the kind intention. So,
excellent presentation. Very rightly he has said that any patient where indication is there for trifocal, we have to do the counseling. Counseling is one of the most important thing. And if you guarantee that 100% of the people, 100% of those people having trifocal get excellent near and distance vision, then you can be in problem. So you say actually that what percent, how much there is a chances, you say that's okay, 90, 92% or 88 to 90%, still 10 to 12% of the patient, they may need some number either for near or distance. So you have to give the actual figure, not guarantee patient. Very rightly he has said that any patient, diabetic patients having, we do OCT of these patient. If there is a macular lesion or if there is even some little swelling, these are the patient which are not suitable for performing trifocal. So we have to exclude, as already he has said, age-related macular degeneration, or if there is a diabetic maculopathy, or even starting of diabetic retinopathy, they are not suitable. So most important is do not guarantee, but say that what will be the likely outcome. Thank you so much for your excellent presentation.
Thank you so much. Just 2 examples, yesterday and today, what I faced, so that motivated me to address this issue more. That when I came out of the airport yesterday, sir, there was air conditioning inside. When I came out, there was a lot of mist on my glasses. Then I realized, had I got a trifocal implanted, I mean, people who have got trifocal implanted. Without using a glass, they could have easily got out of the airport. And secondly, today in the morning when I was trying to, from my computer, I was trying to get it into my pen drive, right, copy it into my spectacles at night slipped inside the bed, sir. I could not find it for 10 minutes. Then again I realized, so how good the trifocals would be. You don't have to search in the morning. And I was really anxious how to transfer it on the pen drive. So that two incidences that gives a focus to the fact that trifocals are really an answer.
Thank you, Dr. Saab. Thank you so much. Thank you, Dr. Pranav.
I would request Dr. Partha Biswas to hand over the memento to Dr. Pranav Ranjan, sir.